Hi, everybody. Thanks for listening in, watching. One thing that I want to discuss today is resting oral posture. And it might seem like I'm really excited about this, but this is actually one of the fundamentals that we focus on at Clear for Pediatric Dentistry. And it's something we talk a lot about at every appointment. So if you're my patient, you're familiar with this topic. But one thing that we ask, among many things we ask when our patients come in for their first visit and at every subsequent visit, is that we ask our families if our patients seem to have a good lip seal at rest, and or if it seems like the lips are parted, even just a little bit. And most often, I would say upwards of 90% families are unsure. It's not something they've ever really looked for. It's not something on their radar. So sometimes we'll just have to follow up next time, or just ask families to look out for it. Because if the mouth is open, even at rest, even just a tiny bit, and my patients are moving air through their mouth, there can be some surprising effects and consequences of that. So if our patients breathe through their mouths, then the air is going to dry those oral structures, and versus like if we are able to breathe through our nose, because this air is humidified. We want our lips closed. We want the saliva constantly bathing these teeth. And one of the main reasons for that is to keep the pH of the mouth nice and neutral. When air moves through here and these structures get dry, the pH of the mouth goes way down. And that creates an acidic environment. And then the bacteria that causes tooth decay grows and thrives in an acidic environment. And so if you move air through your mouth, even just a little bit, even 10% of the time, can make a difference. Your risk for cavities goes up. And also, if our patient breathe through their mouth, again, even it seems like it's open just a tiny bit, it means the tongue's on the floor of the mouth. And why do I care about that? Because we want the tongue up in the palate. This is where it's supposed to be. We want our tongue up here, because if our tongue is up here, it works as a natural expander. We get good forward growth, good horizontal growth. And that means not only is our jaw big enough to accommodate the structures that are going to erupt, the teeth, right? We see less crowding, but we also get good lip support. It also helps develop these cheekbones. If the maxilla, this upper jaw, develops well, that's the center of the face. So then we get good lip support, we get good cheekbone development, good orbital floor development. So that's a really big deal. And moreover, that lower jaw wants to follow that upper jaw. So if this ends up deficient because that tongue is down, and so this maxilla ends up more narrow, set farther back, then the same thing's going to happen with the lower jaw. And we can see some almost like a distalization of the condyles back into this joint, and then we can have problems there. Lots of people end up with temporomandibular joint dysfunction, which can be a real bummer. Also, an important factor is that our lips are our natural braces. So if we get that good lip seal, that just provides a really good boundary so our teeth know where to stop. Everything wants to exist in opposition, right? This upper jaw will grow until it finds that tongue. So if we see that tongue doesn't meet that opposition, this upper jaw grows down, right? You see more gums when you smile. And then same thing with these lips here. We really want these sealed so that it can exist in good opposition, so those teeth will grow outward to that lip, versus if we're open, that those teeth are going to grow. The eruption could potentially grow down. We could see some over eruption of those teeth. So that's just a really critical factor, and relates to, an increased cavity risk, and potential crowding, orthodontic issues, and even those temporomandibular joint problems. So we try to identify our patients who are at risk for this mouth breathing, and we'll tailor an approach based on their individual needs and what the family thinks will be reasonable for them to implement to help them be successful with that and develop that really good lip seal to help with overall health and wellness and their dental health and growth and development. So thanks for sticking with me on this one. I hope that you have any questions, please feel free to reach out. Thanks.